Well, welcome to this talk. It's still Tuesday, the 17th of January now. I want to look at what's going on in China, and we'll look at why this is so relevant for us in Western countries as well. So let's dive into what's happening in China. Now, as you'll probably remember, there was an abrupt U-turn. The zero COVID policy in China was completely, essentially abandoned on the 7th of December. Now, what was actually happening was people were getting negative COVID tests so they could go out and carry on with their normal lives in the informal sector, shall we say. So this meant that COVID had actually broken out already. It was unstoppable in the Chinese context, and the government merely bowed to what was inevitable. That is the main thing that happened. It's not as if it was a planned strategic decision. It was just had to happen because it had happened already. Only people who died of respiratory failure were counted as deaths in China. This was the big thing. Now, it's very difficult to work out what's going on in China for two reasons. First is, as we know, complete lack of transparency in China. Every time I talk about Chinese figures, people say you can't believe a thing that comes out of China. That's not quite true. You can get some pretty interesting indications, but complete lack of transparency. But the other thing that clouds the Chinese situation equally, in my view, is vested Western interests that want to make what is going on in China look bad, partly to make it look like what we did and are doing as good. And it's just not yin and yang like that. It's not black and white like that. It's far more nuanced than that. So I don't trust the Chinese data, but I don't trust a lot of what's being said about Chinese data in the West either. So what I've done is I've tried to put together what seems to make sense at the moment. And of course, as we'll see, there's a lot of latitude in that. So this was clearly people that were dying of respiratory failure, people that were getting the acute respiratory distress syndrome as the lungs fill up with fluid. Clearly, we know in Omicron, thankfully, that has the vast minority of people. So everyone in China, and then indeed the whole world, certainly everyone in China, can be remarkably grateful that the virus that is spreading across China now is not Delta, is not the original Wuhan strain, is not Alpha, but is Omicron. And that's not the Chinese being clever. It's not us being clever. Thankfully, Omicron in the world has replaced these more deadly strains. And I think that's more good fortune and grace rather than anything else. To be quite honest, it's nothing clever that we've done for sure. Now, Bureau of Administration in China, between the 8th of December and the 12th of January, they're now admitting to 60,000 deaths in hospitals. Now, clearly there's going to be more deaths than that because a lot of people have died at home. But in Chinese culture, when people are sick, they do try and get into hospital. So I do believe this could account for the majority of deaths. Whether this figure is a fabrication, we can take it as a minimum. I think we can take it as a minimum. But that is what is being reported, and it certainly makes a lot more sense than the previous ones. The deaths from respiratory failure are 5,500, which isn't too surprising that a few people get pneumonia in a country of 1.4 billion people. Now, whether this is the typical COVID pneumonia that we saw early in the pandemic with the typical ground glass white opacity appearance on the x-rays, we simply don't know yet. Or whether it's people that just happen to develop pneumonia because they have a viral infection, as people can. So lack of information there, but the numbers do appear to be relatively small. And even if we double these numbers, they're still not absolutely huge for the size of the country. The people that died did have underlying health conditions. And this probably is fairly accurate. The average age of death in China is 80 years. And people aged 65 and over account for 90% of just over 90% of the deaths. So we are seeing this same pattern that primarily it's the older people that are tragically dying earlier than they would have done. That is certainly happening. And 90% of deaths are over the age of 65. That means thankfully we're not seeing many younger people and middle-aged people dying in China, which is that's better, obviously. Now, Lunar New Year, people are starting to move around now, the Chinese New Year. I think it starts officially on the 21st of January, so it's a few days yet. But people are moving around now. And what's happened so far is the wave in China has been largely in the city areas, and so it'll move well and truly into the provinces in the next week or two. I think I heard somewhere that there's over 2 billion journeys being carried out in China, so some people must be taking more than one journey. But basically, everyone returns home. It's a bit like the Roman census. Everyone returns to their own city during the Chinese New Year. Now, Peking University, infections, 900 million people probably infected so far. Now, this is based on pretty ropey data, to be quite honest. It's based largely on internet searches. So they're saying 900 million people have been infected so far, 64% of the population. Although the way they've derived that data is not valid, it does kind of make sense that those are the numbers we are talking about. Probably more people being infected with COVID now than there ever has been, or at least in the past week or two. Major cities infection rates where there is a bit more testing, 70 to 90%. So major cities, rural villages, more isolated villages, not yet, but that will be coming, as we've said, in the next week or two. Infection rates up to 91% in some provinces. So we can see that basically this is it's done exactly what we've said. It's spread really, really rapidly through all of China. Just rampant through all of China. Chinese Centre for Chinese CDC, basically they're not publishing infection figures now. These were based on academic, although official academic estimates. Now, the infection fatality rate, very speculative really, but 900 million infections, 60,000 deaths, that gives a very low 1 person in 15,000 dying. Infection fatality rate, very low. Now, the more pessimistic, we looked at a detailed estimate from the from Washington State University, really, the office for their statistical branch, and health metrics and evaluation. And they estimated, I think it was about just under 300,000 deaths in China. So more pessimistic estimates, 1 million. But of course, even if it is, if we take the more pessimistic estimates, clearly that's 1 death per 1,400 people, or an infection fatality rate of 0.7, I think. So although this is a problem, it's not absolutely huge. It's nothing like the catastrophic death rate we would have seen in the early waves of the pandemic had it not been for Omicron. Now, of course, even WHO, who are good mates with China, to put it mildly, they were whinging about the lack of data. So there's been this meeting with Dr. Tedros and China's National Health Commission, and they do say this: the overall epidemiology reflects a rapid and intense wave of disease caused by known subvariants of Omicron, and these are the subvariants, and we'll look at the influence of that. In fact, we'll mention that now. Arriving soon. We know that, so these are basically Omicron BA5s and derivatives. The one that's called BF7 is actually a BA5 derivative as well. We know that XBB 1.1.5 is more infectious, so that will come. People will become reinfected to some extent. And CH11 also. So China are going to get these as well soon. Because although this will provide a lot of immunity, there is a lot of reinfections with these in the Western countries, so they will be arriving in China. That will cause minimal disease, of course, in the vast majority of people. And back to China, higher impact in those with older and underlying conditions, of course, confirmed by agreed with the WHO and the Chinese authority, as we've seen in other countries. Now, the big question here, will China become endemic? Now, it's endemic in the UK. Let's look at the Zoe data. 1 in 26 people currently infected in the UK. Last week, the Office for National Statistics, ONS prevalence 1 in 25. So it's about 4% of people infected at any one time. This is really quite a big, quite a big thing. But thankfully, not many getting very sick with it. Quick look at some data there. This is the latest data from the health study, and we do see that the cases are currently going down. These are probably caused by various variants that have come along, such as the XBB 1.5. Confirmed by the Office for National Statistics, quite a dramatic jump, starting to drift off down now, but of course the Zoe data is more up to date. This is the number of people, so the orange is people with non-COVID respiratory illnesses. So this is non-COVID colds, this is COVID colds, and we see both are going down at the moment in the UK. And this is the hospitalisations. Intensive cares remain very low, and hospitalisations are actually starting to go down a bit. And even for these hospitalisations, we know that the majority now are incidental findings. Now, is it going to become endemic in China is interesting. Now, just before I answer that question, I'm going to just look at the situation in Uganda, where there's no COVID and no Ebola. So a quick report from Wafafa here in Uganda. If we can get that, I think we can get that on. There we go.
The treatment center for COVID-19 in the whole region, and I found when the treatment centers were closed some months ago, actually the places that were used for treating and receiving COVID-19 patients on casualty department had been converted into places to be used as triage centers for Ebola virus patients. But I went there and I was able to check. The beds were empty, and I've gotten that video for you. So let's go into it. The tents that you're seeing are the ones that were used in the treatment and testing of COVID-19 patients. They are located outside the emergency department of the largest hospital where I happen to be working. Now, when COVID-19 reduced and we were no longer receiving cases, remember we had Ebola. So this place was empty and closed. So we had to convert it into the treatment and triage center for Ebola patients. And as I talk, inside is now empty because we no longer have the Ebola virus cases. We last recorded on 2nd of December that we have not yet received the case, and up to now we don't have. So right now it is not used for Ebola and it's not used for COVID-19. As you've seen,
So that's actually really good news, isn't it? They built these reception centres in this regional hospital in Uganda for COVID. There was no one with COVID there, so they adapted it for Ebola. And now there's no one with COVID or no one with Ebola who needs treated in those centres. So that's really good news. So essentially in Africa, we can say that there's no, or at least in Uganda and from other parts of Africa as far as we know, doesn't seem to be any symptomatic COVID around. Now, is it there circulating? Is an interesting question, or not. Now, we know it's circulating in the UK. It doesn't appear to be circulating in Uganda, although we don't have the testing, but we're certainly not seeing the symptomatic cases in Uganda and other parts of Africa, indicating the level of endemicity in Africa is low. So what is the difference? We seem to have low levels of endemicity in Africa, high levels of endemicity in the UK and the United States. Well, I think that vaccination is probably quite a big factor. So it looks to me like vaccination, the ongoing COVID vaccination program, which we have in the UK and the States, and we certainly do not have in Uganda, is a factor. So there's mutations going on all the time. So if someone's been recently vaccinated, they'll have a level of resistance. So the mutants that arise, if there's a mutant that arises that's able to escape the immunity generated by the vaccine, that is the mutant that will replicate and then spread on. So it looks like a lot of the variants and the ongoing endemicity in the Western countries is probably as a result of vaccine-induced immunity acting as an evolutionary driver. We're not hearing anything on the government from this at the moment, so I look forward to hearing about that. That would be interesting. So what that would mean is if they decide for ongoing vaccination in China, they may have a level of endemicity. If they decide against that in China, hopefully they'll go the way of Uganda, which would always good to go to low levels of endemicity, because we've got plenty of other diseases to worry about. So interesting what will happen in China. Will they become endemic? Don't know yet. Depends on what they choose to do with vaccines primarily, as long as they're not messing around with other things in laboratories. Which way is that going to go? We will watch with interest. And of course, the Chinese have not and are still not using mRNA vaccines. The vaccine that they used in China was an attenuated, basically a mushed up dead virus. So they have not gone down the mRNA vaccine route. Quite why that is, we don't know. Is it that they have it's a national pride thing that they don't want to use foreign vaccines, or do they know something that's not readily known by the authorities in the West in terms of risk-benefit analysis? Quite intriguing, but we'll leave it there, and thank you for watching.